Let's come to this now. The rape of men and their vulnerabilities to sexual abuse and rape need to be addressed. That's according to SA Medical Research Council, rather. This is a study which was titled Unspoken Victims. It found significant differences in the occurrences and reporting of male rape. Dr. Maseline Machisa from the council joins us now for more details. Doc, thank you so much for your time and good morning to you. You've entitled, this assessment or even research, the Unspoken Victims. Does this imply that men, of course, who fall victims of rape are often reported, or even at times this topic is not widely covered?
Thanks for having me. Just to give a bit of a background about the study itself. So we conducted a longitudinal study that looked at a sample of rape cases that were reported to the police in 2012. And this was a sample of 3,960 cases. And when we looked at that data, we actually found that, most of the rapes that were happening that were being reported were those of females. And yet our data showed that, men or boys are also experiencing rape. And yet, the research that actually just looks at men's or boys' rapes is not really well documented. And so we thought it was important to do a secondary analysis of that data set, and so that we are able to understand better what is happening in terms of rapes of boys and men. Indeed, that's why we sort of have titled this article that you are referring to as the Unspoken Victims, because many a times we don't talk about it, and we talk more about rape of children, and in there we conflate both boys and girls. But we thought it was important to actually highlight this problem. And you are right to say that it's not something that's not talked about, but also we have problems of underreporting, whereby there are rape myths that are there about men who get raped, and these kind of deter victims from reporting.
Right. So, Doc, in that case, then, what have you found in the research? What information, what assessments, and just further data have you found there regarding men and young boys who are raped?
So I think what we've found is that, there are differences about how rape occurs by the age of the victims. And we found that, the rapes of men who are adults is a bit more forceful. There is a use of violence, use of, in this case, physical force. There is use of weapons. There is use of, there's humiliation. It's kind of more brutal in the sense of the physical violence thereof. And therefore you find that victims have more injuries that are of a non-genital characteristic. We also found that, these rapes of men are reported earlier. And in comparison, when boys are raped, it is by somebody that they know. It is in home settings. And it is, there is more the use of coercive tactics rather than physical violence. And these rapes are reported much later, and that brings in challenges in terms of how they are investigated and how we are able to get prosecutions for them, because forensic evidence is often difficult to collect and to utilize when cases are reported later. But just to say that, these differences that we are seeing in the male rapes are not very peculiar, because they are almost similar to what we see with the female rapes in terms of, there being physical force, because adults are more likely to be resisting their perpetrator. And also the issue of late reporting, because normally with children, it is only when, you notice that there's a difference in the child's behaviors, or maybe there are other health symptoms that are coming up, that people awaken to the fact that the child has been abused.
Right.
So that's what we are seeing in this data.
And Doc, just before I let you go, it seems that the study has further expanded even on the setting of where these rapes are, even where the rapes are conducted by the perpetrator. Because I think in the past there was preconception that it's only males and men who are incarcerated that experienced more rapes, that went through a rape ordeal. But your study is showing that, prisons or incarceration is not the only setting where we find such cases.
You're right, because what we did find is, in addition to the, prison settings, men were also reporting sexual violence or rape in other settings. And for us, what was quite interesting was the healthcare facilities, healthcare settings. And of course, we are quite limited in terms of this data, in that it was a retrospective documentary analysis of dockets. And so it will be important for us to do further research to actually understand what's happening in terms of rape in healthcare settings, whether these are mental facilities, whether these are long-term or short-term facilities. We need to understand that better. But you're right that we are seeing that rape is happening more, not just in prison settings, but also in healthcare settings. And we need to think about how do we protect males in these settings.
We'll leave it at that. Thank you so much, Dr. Meseline Machesa, for joining us.